Okay guys, welcome back. For this part we're going to be running through the muscle anatomy. Again, for juniors this will be your first muscle anatomy piece, so you want to follow along in the book, page 123. As I go through these muscles and talk about their attachments and actions, I will be drawing the muscles on Asher, and then we might do some things around movement a little bit separately since we have the luxury of video. So for now we're just going to sort of draw through these muscles, and again, so your big focus is looking at the attachments of the muscles, what bones and bony landmarks they're attaching to, and sort of just starting to envision these muscles as they live on the body. So we're going to be starting with flexor digitorum brevis, and in fact the first three muscles we're going to talk about all live on the bottom or plantar surface of the foot. Okay, so for flexor digitorum brevis we're looking at the calcaneus as the point of origin, as you can see right here. So we all know the calcaneus is the heel, but it does pretty large tarsal bone. It's going to wrap and encompass the whole bottom of the heel here. So this is still calcaneal territory. And then it's going to have individual fibers that go out to the second, third, fourth, and the fifth digit, specifically to the proximal phalange, so the phalange closest to the heel or closest to the body. So it has fibers going out to each individual toe. So when this muscle fires, it is able to flex the digits, which is hard to do just those four. Asher may be capable. Oh, he's doing like the metal horns with his feet there, but not quite isolating. So you're going to end up flexing your big toe with your other toes, right? But this one specifically for the lateral four, we'll learn that for the big toe, there's a separate muscle. Okay, so flexor digitorum brevis, originating on the calcaneus, inserting on the proximal phalanges of the lateral foretoes, performing flexion of the lateral foretoes. Okay, next we have a muscle called abductor digiti minimi. The term digiti minimi should draw you to the small toe. Okay, so this is also going to originate on the calcaneus, but it's going to travel down to the base of the proximal phalanx of the fifth digit. So it's really just going down to that fifth digit right there, still from the calcaneus. It will flex that fifth digit, just like the brevis did, but in addition to that, it will perform abduction, which is, again, like spreading the toes. Something that Asher kind of mightily struggles with. His little toe just wants to flex. But if you can imagine the toes spreading out and away, that would be the job of this muscle as well, as to spread. Okay, not unusual, by the way. A lot of people struggle with discipline in their little digit. Okay, so lastly, we're going to head to the medial side of the foot, where we're going to have abductor or abductor hallucis, and hallucis is going to be our term for the big toe. Okay, so again, calcaneus, traveling down to the base of the middle phalange of the first digit or big toe. All right, and like digiti minimi, it's going to be a flexor of the big toe, and it's going to be an abductor, and that one Asher can do. He can spread that toe out. Okay, so spreading that toe out. Okay, so again, three muscles on the bottom of the foot: flexor digitorum brevis, originating on the calcaneus, inserting on the proximal phalanges of the lateral foretoes, performing flexion of the lateral foretoes. Abductor digiti minimi, originating on the calcaneus, inserting on the base of the proximal phalanx of the fifth digit, performing flexion and abduction of that fifth digit. An abductor or abductor hallucis, originating on the calcaneus, inserting on the base of the middle phalange of the first digit, performing flexion of the first digit and abduction. All right, from there we're going to move to calf muscles. Hopefully you guys can get that angle and see what's going on here. We're going to start with gastrocnemius. Gastrocnemius is our most superficial calf muscle. It's the one closest to the skin, and it is a two-bellied muscle. It's going to have a medial and a lateral head. Let me scoot this back, guys, sorry, so you can see the knee portion here. Okay, it's going to have attachments on the lateral and the medial condyles of the femur. So it's going to have a lateral head and a medial head. Okay, these two bellies are going to travel down and ultimately insert in the or at the base of the calcaneus by way of a familiar tendon for a lot of you guys, which is the Achilles tendon. So this is one of what you'll learn is three muscles that form the Achilles tendon. All right, so how this is going to look is you're going to have two pretty large bellies here. Okay, they come together like this and sort of form the teardrop image in the back of the calf. All right. And then right about mid-calf, they are going to form a very large tendon that's going to travel into that calcaneal attachment, okay? So that tendinous portion is the Achilles tendon, okay? This is our gastrocnemius, okay? All right, if we were to go deep to that, meaning if we were to remove this muscle and go deeper to it, we would find a muscle called soleus. And soleus is going to be on three structures. So just to take a little moment here, between our tibia and fibula, if you look on a skeleton, there's an empty space there. But what's actually there is something called an interosseous membrane. Okay, so if we were to look deep into there, we would see posterior fibula, posterior tibia, and interosseous membrane, all as attachment points for soleus. Okay, posterior tibia, posterior fibula or fibular head, and interosseous membrane. So it's really making its origin on all three of those structures. So imagine I'm deeper to gastroc now, right? So posterior tibial shaft, okay, posterior fibular head, and interosseous membrane. It's kind of on all three of those structures. Then it's going to travel down deep to this gastroc and also feed into that Achilles tendon. So it's going to share the same insertion, which is going to be the posterior calcaneus via the Achilles tendon. So this is muscle 2 that forms the Achilles tendon. We have gastrocnemius with its medial and lateral heads. We have deep to that soleus. And last, which is the next muscle, is what we call plantaris. Now plantaris is going to make its origin on the lateral epicondyle. So we'll go back to where this lateral head of gastroc is, and right above that would be the epicondyle, okay? And then it's going to form a very small belly right here, and then immediately become tendon, which I have just randomly decided is orange for tendon. And that's going to feed also into that Achilles and ultimately into the calcaneus. So just to sort of show the view from the posterior side here so you guys can see this better, okay? All right, so where you see the two blue here, this is going to be gastrocnemius, originating on the medial and lateral condyles of the femur. The bellies are going to travel down to form the Achilles tendon, ultimately inserting into the calcaneus. Second is soleus. It's going to be on the posterior tibial shaft, posterior fibular head, and interosseous membrane, also merging into the Achilles tendon to the posterior calcaneus. Last is going to be plantaris, originating on the lateral epicondyle, traveling down, mostly tendinous, again into the Achilles tendon and posterior calcaneus. So essentially, all three of these muscles share the same insertion and also form the Achilles. So we have a nickname for these three. It's called the triceps surae. Now, as far as actions, all three of these muscles crossing the ankle at the calcaneus are going to be performing plantar flexion. So gastroc, soleus, and plantaris all perform plantar flexion. However, you'll notice that gastroc and plantaris also pass the posterior knee. So they will, in addition to plantar flexion, form or perform knee flexion. So flexion of the knee. Okay. Sorry, I know that angle was a little bit rough there. Make sure you guys got a good view of those muscles. All right. So we are going to shift over to this other leg so we can get a nice view of our last four muscles. So I'm going to take a little pause here and then I will come right back. And so we really don't have any space on this leg to do our deep calf muscles or our popliteus. So we're going to use this leg for that. Okay. The first one is going to be popliteus, which really isn't the calf muscle. It's really just a posterior knee muscle, okay? It is going to originate on the lateral condyle of the femur. So right there with that lateral head of gastroc, the lateral condyle of the femur. And it's just simply going to insert into the posterior tibial shaft, right here. This is not a very big muscle. It's really just traveling in a diagonal direction across the posterior knee, or the popliteal fossa, from lateral to medial, okay? This is a very deep muscle. It's going to be down and around the joint capsule, and it is performing two actions, which is going to be knee flexion. It's also going to be performing medial rotation of a flexed knee. Now, the combination of those two movements, the reason this is so important is because when you are in knee extension, there's something called a screw home mechanism, which really just means that the knee, literally, the condyles of the femur and tibia rotate and lock in place. So in order to unlock that, to go into flexion, popliteus plays that role of unlocking the knee. So the nickname for popliteus is the key that unlocks the knee. It's a very subtle motion, but it's one of those things that when you have somebody who has a really hard time going into full knee extension, it's very likely that this is the muscle that's problematic, because they aren't able to lock in that knee because they can't unlock it because the muscle is too problematic, right? So you'll see this somewhat often in the gym going community, especially the ones moving a lot of weights. Okay, so from there, we're going to act as though these calf muscles here have been removed from the body, and we're looking deeper in. We're going to have three what we call deep calf muscles: tibialis posterior, flexor hallucis longus, and flexor digitorum longus. I believe flexor digitorum longus is going to be your first one. Either way, we'll cover all three. So flexor digitorum longus is going to be originating on the posterior tibial shaft. And then it is going to travel down, and it will ultimately insert on the lateral four toes, just like we had with the brevis, our first muscle. It's going to be the distal phalanges of the lateral four toes, okay? Right there. All right. So to draw this muscle, okay, keep it blue here. There'll be a muscle belly heading, again, very, very deep here. Right along that posterior tibial shaft, okay? And then right about there, it's going to form tendon. It's going to pass behind the medial malleolus. So if we find the medial malleolus here, it's going to pass behind that medial malleolus and have four individual tendons that go to each toe. All right, 1, 2, 3, and 4 to those distal phalanges of the lateral four toes. Okay, so those tendons are going to sit in and around that brevis, which we did on the first foot. Okay, so flexor digitorum longus originating on the posterior tibial shaft, inserting on the distal phalanges of the lateral four toes. So it's going to be involved in flexion of the lateral four toes, just like brevis. However, it does also cross the ankle, so it will be a plantar flexor. Okay. Next, we have flexor hallucis longus, originating on the posterior fibular shaft, okay, which is going to be out lateral, okay, and it is going to travel down. Just like our digitorum, it has a tendon that will still pass the posterior to that medial malleolus, so going towards the inside, and then it will make a straight shot for that distal phalanx of the big toe. Okay, straight down to the distal phalanx of that big toe. Okay, so it will be involved in flexion of the big toe, and it will also be involved in plantar flexion of the ankle. Okay. Last, we have tibialis posterior, which is going to be on the posterior tibial shaft, posterior fibular shaft, and the interosseous membrane. So it's sort of on all three structures back there. Let's try going with green here. Posterior tibial shaft, posterior fibular shaft, and interosseous membrane. Okay, then it's going to have a deep middle belly right here. Okay, that will form a tendon, also passing posterior to the medial malleolus, and it's not going to go into the toes though. It's really just going to invest into the base of the tarsals and metatarsals right here. So really just feeding, you can see here, feeding into that medial arch along those tarsals and metatarsals here. So just like a lot of our previous muscles, it is a plantar flexor, okay? But because it's feeding into the inside here, it can pull into inversion. So it is our first inverter of PLEC, okay? So to recap all of this, okay, let's scoot this back just a little bit here. All right, to recap all of this, all right, we've got our three muscles that occupy the bottom of the foot: flexor digitorum brevis, abductor hallucis, and abductor digiti minimi. Flexor digitorum brevis is originating on the calcaneus, inserting on the proximal phalanges of the lateral foretoes, and it will perform flexion of the lateral foretoes. Abductor digiti minimi, originating also on the calcaneus, inserting on the proximal phalange of the fifth digit, and it will perform flexion and abduction of that fifth digit. Abductor hallucis, originating on the calcaneus, inserting on the proximal or middle phalange of that first digit, it will perform flexion and abduction of that first digit. Okay? Moving into our three superficial calf muscles, what we call the triceps surae. Gastrocnemius, originating on the medial and lateral condyles of the femur, inserting on the calcaneus via the Achilles tendon. It is a plantar flexor and a flexor of the knee. Soleus, originating on the posterior tibial shaft, posterior fibular head, and interosseous membrane, inserting on the calcaneus via the Achilles tendon. It will perform just plantar flexion. A couple things about this muscle real quick. Soleus, of all your plantar flexors, is your prime mover. You definitely want to know that, guys. Prime mover is soleus. You also want to know that soleus has a nickname, which is the second heart pump, because activation in this tissue is one of the biggest contributors to returning venous blood flow back up to the heart. So if you, for whatever reason, you get casted, you're unable to move your leg, unable to fire that muscle, you will swell because the fluid will just build up in the ankle. Okay, so prime plantar flexor, second heart pump. Okay. And third, plantaris, originating on the lateral epicondyle, inserting on the calcaneus via the Achilles tendon. It is a plantar flexor and a knee flexor, just like gastrocnemius. So, again, remember, plantaris, soleus, gastroc are the three muscles that form your Achilles. We call them the triceps surae. All right? From there, we have our one posterior knee muscle here, which is popliteus, originating on the lateral condyle of the femur, inserting on the posterior tibial shaft. It is a muscle that performs flexion and medial rotation of a flexed knee, which is really just a movement mechanism to unlock the knee. So the name of this muscle is the key that unlocks the knee. And then we have our remaining three deep calves: flexor digitorum longus, originating on the posterior tibial shaft, inserting on the distal phalanges of the lateral foretoes. It will be a flexor of the lateral foretoes and a plantar flexor. Flexor hallucis longus, originating on the posterior fibular shaft, inserting on the distal phalange of the first digit. It will be a flexor of the first digit and a plantar flexor. Lastly is tibialis posterior, originating on the posterior tibia, posterior fibula, and interosseous membrane, inserting into the tarsals and metatarsals at the base of the feet. It is a plantar flexor and an inverter. One last thing to mention, guys, with the deep calves, there's a saying that we use, which is Tom, Dick, and Harry. Tom for tibialis posterior, Dick for flexor digitorum, and Harry for flexor hallucis. Describes how the tendons pass anterior to posterior behind the medial malleolus. So if I was to take a finger on the medial malleolus and roll back, the structures I would roll across would be first Tom, tibialis posterior, then Dick, flexor digitorum longus, and would be the tibial artery. The tibial nerve would also be there. And then from there we would hit the flexor hallucis, which would be Harry. And this is really important because if there's actually a condition called tarsal tunnel syndrome, which sometimes manual therapy can help, but usually it's an adjustment thing around the ankle. But that is where the compression tends to occur, is along the posterior tibial nerve through here. So sometimes we can go in and do manual therapy there for that. But those are the muscles.